Hey everyone, and welcome to the office hours for ESG-CV reporting. I do want to make very clear from the start that while this is intended and will be a Q&A session or office hours, we are going to spend just a little bit of time at the beginning of this session to go through a couple frequently asked questions or issues that we know have come up since the trainings were held on ESG reporting last week and in the weeks before that. So before we get into that content, I just want to give a few brief logistical items for everyone. So one is that if you're having issues with your audio, please go ahead and switch over to the phone audio. We have found that the phone audio tends to be a clear, better connection. So you can do that at any point throughout the webinar, and we will go ahead and put that information in the chat in just a few minutes. Additionally, I do want to make clear that this session is being recorded, and a copy of the slides that we go through along with the recording will be posted within 2 to 3 business days on the HUD Exchange website. Additionally, because this is in office hours, we have a couple ways that we're going to try to interact with you. So primarily, we're going to use the way to connect with you through chat, but we can also use hand raising. So if you verbally want to ask a question at any point during the webinar, you can look on your screen right now, and in the center of your screen you should see sort of a row of icons. One of them looks just like a person. If you click on that, that's going to open up the participants list on the right-hand side of your screen. Once that opens up, you should get a pop-up that looks very similar to what you see right now, and I see someone just raised their hand, so they're testing that out. That's great. And what you'll do is you'll click just that icon that's showing up in the bottom right-hand of your screen to raise your hand. And once you raise your hand, the team will, as soon as they can, unmute you and look to get the, again, sort of verbal question from you. When you're done with your question, just go ahead and make sure to lower your hand so we don't think that we've left you hanging or that you still have a question. And you can do that just by clicking on the raise hand icon again, and that'll lower the hand for you. If you don't feel like talking to us verbally, though, we absolutely still have the chat functionality that you can use throughout the webinar. So to get to that, just look at that same row of icons. It looks just like a message bubble. When you are sending those chat messages, which you can put your questions, issues that you may be having, go ahead and make sure that you're submitting them to everyone. That will ensure that all of the presenters and panelists that we have today get to see that question as well, along with the participants. And lastly, I am just going to mention who is going to be joining us today as presenters. So first and foremost, we have William Snow from HUD's Office of Special Needs Assistance Programs, and he is joined by both Michelle Budsick and Meredith Alspa from the Partnership Center. And we've got myself and Tommy Jo Bednar behind the scenes helping out with tech. And of course, we've got some more folks that are also helping out with tech and with Q&A support. And with that, I'm going to turn things over to William to go ahead and get the brief presentation started. William?
All right. Thank you, Natalie, for opening another office hours. This is 6 months straight of Natalie opening office hours. We really appreciate that. I should have said, or I want to say early, that this is going to be focused on ESG-CV quarterly reporting. I understand you may still have ESG notice questions and other implementation questions. Not only do I not know the answers to many of your very in-depth questions on that, we want to focus this on the reporting side. So if you ask a question about the notice, I will try to answer if it's in the context of the quarterly reporting, but there are many things I probably cannot answer, and I'm happy to tell you I can't answer that if the question comes up. So just wanted to be clear about what this session is focused on. And before we take any questions, as Natalie already said, we want to cover a few things that we've seen many questions on in the earlier sessions and through AAQs. So the very first thing we want to cover is roles. This one is very fun and very confusing, so we want to try to take a second to see if we can unpack it. So we have, as a starter, recipients. Recipients get our money, right? They're the ones on the grant agreement. So a recipient is the place to start, even in reporting, because at the end of the day, the recipient has to start the reporting process and the recipient will have to end the reporting process. So to begin the reporting process, they need to go into Sage and identify the proper contacts for the HMIS involved, right? It could be one HMIS if a single jurisdiction is all you're working with. It could be many HMISs if you're a lucky state provider and there's several COCs with different HMIS implementations. We covered that in depth in the last 2 sessions, so I'm not going to go in depth here unless we have questions. But starting with the recipient identifies who the proper HMIS contact is, as well as any victim service provider subrecipients. Then the recipient will bundle or create bundles in Sage. So we're using this term bundles a few different ways. So this is, like, to me, the most important part when you hear bundles. In Sage, the recipient will say X, Y, and Z project is associated with bundle number 1, the emergency shelter bundle, right? So they'll include all the projects within a single implementation with a similar time frame associated with start and end, and all those projects will be in that single bundle. There will be a separate bundle created for another project type, right? Rapid rehousing. The recipient will create a bundle for all the projects associated with rapid rehousing. So that's what a bundle is. The bundling happens in Sage by the recipient. They establish, again, who the projects are, and they bundle by HMIS implementation, component type, and operating period, right? If the projects are operating at the same time. So those are the 3 keys there. After that, everything should be easier, because if the bundle is set up correctly, there's a roadmap for the other players to use. So subrecipients is the next one on the screen. Subrecipients do not have to do any reporting. They just collect the data. The one exception is if they're victim service providers. Victim service providers are acting as they always have under ESG. They will be collecting the data and submitting a CSV through a comparable database, just like normal. That's to ensure we're compliant with VAWA and other requirements. So we have the recipient who's setting up the bundles. We have subrecipients who are just collecting the data. Then we have the HMIS leads and the victim service providers. HMIS leads are going to aggregate the data. We sometimes say bundle, but really it's helpful just to think about aggregating data from their HMIS implementation based on the bundle the recipient already set up. So they'll know exactly what projects to include because they'll get the email from the recipients saying, here's a link to do your bundle, and it'll say what projects are included. You'll have 24 hours at the HMIS lead level to ensure all the right projects are in the right bundles. If they're not, you have a chance to provide that feedback to the recipient, and that can get corrected. But really, like for the HMIS sysadmin side, that's the key. You just look at the list, and that tells you who should be included. Maybe you know that there's a project that's not included that should be. Again, provide that feedback to the recipient. They will rebundle and send you another email with a link for you to upload. And then you'll upload the CSV with the correct projects by project type, start date, and by implementation. So I can't reiterate that enough. That's the key right there. And then recipients. Again, after the CSVs have been uploaded by all HMIS leads or victim service providers that need to submit an upload, the recipient will need to go back in, ensure all the screens are filled out, like the financial screen and other screens, and they will hit submit. Please don't forget to hit submit. That's been a historical problem under normal ESG. Just remember that once CSVs are uploaded, that doesn't mean you're done. You need to go back into Sage and hit submit. So we actually wanted to pause here just to answer questions about this role-related issue, because it's a big enough one that we want to answer direct questions about it. So we're going to allow for the open hand or raise hand feature to just address these questions, and then we'll move on.
So, Tommy Jo, it looks like Betty Ronsley has a question if you want to take her off mute.
I see her question in the chat. Great question, Betty. So victim service providers, the rules have not changed in relation to HMIS. You will not be entering data into HMIS. You will use a comparable database, and you'll submit a separate CSV for each victim service provider. So that victim service provider data will not get aggregated by the recipient or by anybody for the purposes of reporting or for recipients to report to HUD. Michelle, it looks like you are adding a comment, but you are on mute still.
Sorry. If I could say that a different way too, a victim service provider is going to enter their data into their comparable database. From their comparable database, they're going to generate that CSV output, the report, and that report is going to get uploaded to Sage. So you don't touch the HMIS still, but you're going to have to do both direct data entry into your comparable database and then output into Sage.
Right. And I want to respond to Audrey's question in the chat as well, which is just the clarification about how, what she has to do as an HMIS lead, and her summary there, and I'm going to read it just so that everyone can hear it as well in case you can't see the chat. She says, so as the HMIS lead, we would have reporting groups set up according to the bundles that the recipient sends, and then run the caper to generate the CSV. That is correct, and I didn't say that earlier, but it's a good reminder that you're really just running the paper for your quarterly reporting that you already have programmed in your HMIS or your comparable database. It is the same exact formula, so yes, you're going to run that caper by each bundle. So again, the hard work is on the recipient side, and as HMIS lead, obviously you may be more familiar or just as familiar with what needs to be in the bundle, so that communication is really important.
So that term reporting group it only works with one software system. So if you don't understand that, it's because you're using a different software system.
And this is Meredith, and I just put my plug in the chat also. But HMIS leads, please contact the email in the chat there to get access to the HMIS lead sysadmin call. Our call is tomorrow at 1 p.m. Eastern. Please bring your HMIS questions to that group where we're focusing exclusively on sort of the HMIS sort of perspective of Sage. This call is a lot of, really focused on the ESG recipient perspective, and we'll do a lot more HMIS work tomorrow.
I'm going to answer the very first question we got first before we move on or see if we have any more questions. And that was Ashley Miller's question about the questions that should be asked here. So yes, this is about reporting, and she asked, is there another space where the other questions about the notice can be answered? That would happen in our normal office hours sessions every Friday. They have a lot of different topics, but we answer a lot of ESG notice, ESG-CV notice questions there. You can also use the AAQ. I do not know if there's another session like an office hours just devoted to the ESG-CV notice that will be provided again, but you can certainly attend the normal office hours on Friday and ask those questions. Did I see any more? Paul asked a question about bundles compiling. I'm not sure I understand your question. The substantial amendment is not related to this bundling, so I'm not sure how that relates here.
If you're not under contract with HUD, then you won't even see the bundles. So if you're seeing the bundles but you're not under contract yet, then you've done a couple steps wrong, and if you put an AAQ in and tell us exactly where you are, we can help you directly.
All right, I'm going to move to the next content just to make sure we can keep moving and also give you a chance to open up for more free questions. Next slide, please. All right, so in this call in particular, the very first meeting, we had not had the ESG-CV notice out, so that changed a few things from what we shared. I think the core of what we're going to talk about in terms of differences are around the eligible activities and some clarification around temporary emergency shelter. So there is a screen, that's section 5 of the reports in SAGE, that allows you to provide a narrative about how you have engaged or used these allowable activities under the notice. So we had spoken about that before. We're not adding a bunch of new CSV upload requirements around those unique activities, but what we do want you to do is tell us what you did, tell us how it relates to preventing, preparing, or responding to COVID. So we just use the big, broad term of what did you do in response to COVID with this activity. So that's going to be a pretty important narrative. I would encourage you to share with us what you can. It's 2,500 character limit, so you can't share at home, but definitely provide as much detail as possible. Next slide, please. So I'm going to start us off on this clarification now, this change in the temporary emergency shelter piece from what we had said before, and Michelle actually is going to run into a few examples after that. So previously, we had talked about temporary emergency shelter being a shelter that doesn't require, or where there is no, where it has not met habitability. The notice is slightly different than that. So let's state what's in the notice. The notice has a definition. I'm actually not going to read the definition here. It's more helpful for the purposes of HMIS project setup and for reporting purposes for us to think about the temporary emergency shelter in these 3 criteria. So all 3 of these criteria have to be met for you to count something as temporary emergency shelter. First, it's either whole or part of a structure that's being used to provide shelter to individuals and families displaced from their normal places of residence or sheltered on shelter locations due to a natural disaster or public health emergency. So I highlighted or bolded the key words here. There is something that was created, structure or portion of a structure, that is used to respond to the public health emergency. That's the key as a starter. It must be for that express purpose to respond to the public health emergency here for COVID purposes. The second requirement, local public health officials have determined that the temporary emergency shelter is necessary for the community's coronavirus response. This is if your documentation hat is on as a recipient, the way to think about this is, has your public health authority made a public statement, either written or oral, that confirms that congregate-style facilities need to have special accommodations? And I use that very broad term. Very rarely are you going to hear a public health authority say, and all these shelters for the homeless must be non-congregate, right? Like, that's not something that you would expect to hear, nor did we hear a lot of in this pandemic. But what we did see was general statements about the need for congregate settings to be spaced out or have special accommodations to ensure safety for COVID-19. So that's a requirement. Your public health authority needs to have made a statement along those lines, and you can rely on that even, again, if it doesn't call out shelter, as long as it talks about congregate living situations. The third criteria, the structure, again, whole or part, is actually in use during the time period to address coronavirus. So this is similar to number 1. Right? Number 1 is the purpose. It's to address the public health emergency. And number 3 is to say you actually used it for that purpose, and you use it in the time frame that's allowable for your funding stream. So ESG-CV, you can only count something that you use as early as January 21st, 2020. If you're trying to claim costs that were before January 21st, we're going to say, well, that wasn't in use during the period that of time needed for coronavirus. So I don't think that's going to be an issue for folks. That feels like an easy criteria to meet, but just want to make sure that that's out there. So you have these three criteria. If these three criteria are met, the recipient or subrecipient, as it may be the case, doesn't have to do a habitability inspection, doesn't have to do an environmental review. So it's not the case that we require them to have failed a habitability review. They simply do not have to conduct one in the first place. I should probably put a little more emphasis on number two of the temporary nature, and this actually applies to the whole thing. These facilities are intended to be temporary. They are intended to be raised up for the public health emergency and taken down after the public health emergency. So that's another important provision here. So this is why we'll need to jump into a couple fun examples, because we know there's some confusion based on the ESG-CV notice webinar and a couple of things about what you do with hotel motels, etc. We'll jump into a little bit of that. Just know we do already have HMIS project setup guidance that actually still stands. We put that out early on, and it still is true, and you can still rely on it, and we linked it here. So know that that's true, and that's good, right? That's something we're consistent with all the way through. So I'm going to turn the time over to Michelle for us to dive a little more on this temporary emergency shelter piece.
So next slide, Tommy, please. So if you thought about what William said about what's a temporary emergency shelter and what kind of things you have to think about, and then you opened and read the notice that the information that we put out about HMIS project setup, you'll find that it aligns really, really well. So let's start with what's an emergency shelter. Of course, an emergency shelter is your normal shelter that you had before COVID and you're going to have after COVID. It's the regular shelters in the community that you're already going to fund. What we found is that there were lots of instances where the shelters felt like they couldn't operate because of physical distancing or staff being afraid of the virus, or for whatever various reason there was, they moved folks from the emergency shelter to hotel, motel kind of rooms. If you did that, we recommended very early on that you just think of those shelter rooms as just a different space for the same shelter, and you continue to enter their data in the regular HMIS, in the regular shelter program. So, yeah, your beds might have fluctuated a little bit, no big deal, it's a short time, but we recognize people did that. If you did that, you just sent people out to a shelter, you're just going to count that as you sheltered people. You're not going to have to create a new hotel-motel program. You're not going to have to show us just the people that were in hotel-motels versus the people that were in your shelter. If you operated both of them because you could, then that's still just one shelter, and you're just going to show that under an emergency shelter. We also talked about overflow. We knew that people would come in from the streets for fear of COVID, or that you would try to get in from the streets so that they weren't going to get it or contaminate other folks. And there's always been capacity for overflow in shelters. We use it for winter shelters. We use it for summer shelters. We use it, all different kinds of times for different capacities, and we gave you right out of the gate the capacity to increase your beds in your regular shelter for this, and just count those as overflow beds. So if you did that again, that's just a straight up emergency shelter. It's not a temporary shelter. It's just an overflow situation in your existing shelter system. Next slide, Tommy Jo. But when you go to a temporary emergency shelter, it really means you're adding something new to an existing organization, like a new emergency shelter for an existing organization that wasn't running a shelter before. Maybe the Red Cross never ran a shelter before for homeless in your community, but with COVID, they were suddenly able to give some space for that, and so they did that, and they're only going to do it temporarily for this corona. Then that counts. Or there's a brand new organization that's associated with doing emergency shelters. Also, again, somebody that's never done one before, an organization itself that's never done one before is going to come in and do a shelter. Some examples of this that we know of, that we've heard of, is where communities have used ESG funds to acquire or renovate a building, even an old hotel, motel kind of building, and retrofit it as a shelter to follow those CDC congregation recommendations and get folks to a new place. So they weren't using a hotel, motel. They were literally opening up a building that they were running as a shelter. Right? There's the difference. It's not an overflow situation. It's a situation where you're adding a whole new shelter program to the mix where it wasn't there before. Same thing for opening a shelter that can respond to the people who are experiencing homelessness that had COVID or that were having the symptoms of COVID. We saw places across the country where the shelters tried to get those folks out of the regular shelters and into an isolation kind of place. That, again, that's a temporary solution. If you did that and you counted it as a shelter, we'll take it as a temporary emergency shelter. You may not have counted it as a shelter if you didn't want to fund it under ESG, and that can be handled then as a medical facility, and we gave you instructions on how to do entry and exit in your projects to account for that medical facility and not let anybody lose their homeless status while that all happened. So those are some kind of examples of where temporary emergency shelter would definitely count. And I'm sure we need to stop here and take some questions.
We do have a couple. I think William answered a couple of them, but we'll hit them again. So what if the temporary emergency shelter is only open for 3 months? Is it still considered temporary?
Yeah, that's a good definition of temporary, 3 months.
Yeah, and I put in my little note there, just the shortness is fine. It could be a week if that were the need, right? Like, that's actually okay. I don't expect that, but it's possible. The length in terms of how long does depend on when you submit your substantial amendment. So the ESG-CV notice does have a limit on temporary emergency shelter. It can't exceed 12 months for a client. I believe that actually there's a date of January 31st, 2022. So you will need to look at the notice for that purpose. But shortness, you can have it quite short if you want. That's fine.
There's another question. In these examples, what happens to the building after the pandemic ends?
So I have to be honest, I don't know the answer to that. What I do know is we don't have a restrictive covenant requirement. So let's say you acquire a facility, a temporary facility, a trailer or something to that effect, and you use that. Unlike normal ESG funding, which has a 3 to 10 year use requirement tied to it, you do not have a use requirement. If you acquire a property or renovate, you will be reporting on that through the duration of the grant, but there are no other provisions for the CARES Act. So it's my understanding that facility is yours at that point. You'll get to determine what's exactly to do with it, but that's worth putting an AAQ in. I know there are a lot of questions about that. and I haven't seen any stipulations to it. So, yeah, feel free to put an AAQ just to verify that piece of it.
Thanks. Would a church be considered a temporary emergency shelter?
It could, if it met the 3 criteria that I put in section or in our slide number 8. It's quite possible.
Tommy Jo, can you flip back to slide 8 for them?
Yeah, I don't see a church very different than I see a rec center, right? Which we saw a lot of communities say, okay, I need to move quickly. I'm going to convert my rec center. You definitely could use a rec center. You could use a church. So, yes, I think a church is an allowable facility type.
The codicil that I would have for that is that if it's an interfaith hospitality network, gosh, what are they called now? There's another name that they go by. If it's one of those and they've just switched churches, that would still be the existing shelter. So if it's within that interfaith network of folks moving from church to church different nights for shelter, you would just keep that as part of the interfaith shelter. You would not have to open a new shelter.
Yeah, and that actually gets at what's on the slide in front of you there. That's if it's a new shelter, right? They bring in a new facility that they do not normally use, a new church that they don't normally use. That's a good example of saying, okay, that's a new facility being used. That's it's going to be a temporary emergency shelter. It's only being used for the purpose of COVID response. Yeah, that's a good example.
We had one from Brent, just clarifying, sort of summarizing what you were just talking about, Michelle. So an existing emergency shelter who is using a hotel due to the fact that they closed shelters for this COVID, it's still an emergency shelter, not a temporary shelter. It's still emergency shelter.
Right.
Yes.
So you didn't have to do new data entry, and everybody should have been entered into your HMIS shelter program, and you're just going to report all those people that are entered into the HMIS shelter program. We tried very hard not to have you do extra data entry for this. So the shelters are really we tried to use your existing emergency shelter structure as much as we could.
Does an Easy Up shade tent qualify as a space that's a temporary emergency shelter if it meets the other criteria?
So I'm not exactly sure what an Easy Up shade tent is. So
I think it's just a canopy tent, no walls, no floor.
At this point, I don't think that would make that, although you can submit an AQ. There are things that we know make it, right, like a rec center, for example, would count as a temporary emergency shelter if used under the criterion in slide 8. But this isn't a free-for-all for every single type of thing. And an Easy Up shade tent, I'm not sure where we would come out on that. So sort of like a normal tent. I don't know that a normal tent would be acceptable either, whereas there are some large pop-up tents. I know San Diego has had one for several years. That's an example that we would say, yes, we do know that that would count as a temporary emergency shelter, but it's not a traditional recreational tent either.
We, in the past, under ESG, a tent, if you put up a tent and you were servicing people in the tent, that was supposed to come under street outreach. So it's not emergency shelter at that point, it's a street outreach program. So if you put the tent up and had people out there working with those folks to get them into housing and stuff, or to get them engaged, you could use that as a street outreach program. And that's where it has been funded traditionally in emergency shelter grant funding.
Are the requirements any different for a day shelter versus an overnight shelter?
You know, I haven't seen anything making different requirements for the two, so I would say no, not that I'm aware of.
Great. So that looks like all of the temporary emergency shelter questions. There were a couple of questions I think William answered around bundling and viewing the report, which I think we'll get to once Michelle gets through the start date slides that she's going to go through next, and then we'll take those questions then. I think you can take it now, Michelle.
Do you see my slides?
I'm still seeing the example of TES.
Tommy Jo, did you pass me the control?
Yes, Michelle, you're the presenter currently.
There we go.
Looks like it's
there we go.
Now.
So we're going to walk through an example of setting reporting start dates for you because we've had a bunch of questions around that, and this is a pretty basic example. So this is an example where you funded 3 shelters over the initial period. One is a real big mass shelter. It's got 400 people that stays there a night on average, and it serves 3,000 people a year. We have a family shelter that has 50 beds in it and averages serving 800 different people a year. And then we have a victim service provider shelter that's 25 beds and averages serving about 400 people a year. Obviously, when you look at this, the largest shelter is Shelter A, right? And so one would think that when Shelter A starts, their reporting start date is going to start. But if these 2 shelters started first, they started in February, the family shelter and the victim service provider shelter started in February, and the mass shelter didn't start until July, serving folks with ESG-CV money. So we know all of these shelters were in action before COVID, and they're going to be in action after COVID. So we're just looking at the period that you funded them with ESG-CV money, and so that's what we're talking about. When did that funding start to happen? When did it hit the streets? So we did some math. We took every shelter, and we just said, how many people a month would this shelter serve if we just divided it by 12? We're just doing a real straight, rough calculation, not anything fancy here. Then we moved to say, okay, how many people would I have served with ESG-CV funding roughly? So I am saying that roughly in Shelter A, here it is 400 bed a night people that averages around 250 a month, 250 different human beings. We're estimating that in a 3-month period, 750 different people would be served. Same thing with B. We got 67 on the monthly, 603 as total being served with COVID funds. C, here's the monthly, 291 served with COVID funds. Add all these people up, and the estimated number of people that you served in emergency shelter with ESG-CV during this period would be 1,644. So now let's do the math. If we started on February 1st, which is one option, right, starting on February 1st, or if we waited and started the report on July 1st, what would happen? So we start on February 1st. These people that were served for 3 months in Shelter A, in reality, all of a sudden now are being counted for 9 months. taking that 750 all the way up to 2250. Shelter B, 603, because that's when they started. Shelter C, 291. Grand total, 3144. If we do a July 1st start date, you're going to see that we're back to the real 750. These people back down some, these people back down some, but the total was 1050. And what we did was we hit as close as we could to the estimated person served without going over. If we would have done this, we would have done a huge overcount, and all of a sudden there were at least 1,500 people, right, that are being counted that shouldn't be counted. So the report start date for this scenario is July 1st. And this kind of format is really simple to use. You can take your, what the emergency shelter reported serving last year to get this monthly estimate. I mean, this isn't a highfalutin estimation. This is trying to be as close to accurate as we can be without inflating the numbers. So that's what we're looking at here. I want to remind you a couple of things. The reporting start date really only, when you're considering that date, you only have to consider the date that a shelter or street outreach program was in operation. So you could substitute shelter A for street outreach, and it would be the same calculation, the same scenario if you funded street outreach, shelter. Again, those programs were there before COVID, and they're going to be there after COVID. What is different is if you started up a homeless prevention project or an RRH project with the ESG-CV money, then those projects are going to sit in their own project within the HMIS, so it doesn't matter. They don't calculate into this calculation, because if you started too early, if you started earlier than the RRH program started, it wouldn't matter because there weren't any people in RRH then, and the report wouldn't show an overcount. The report is just going to show who was served during the time period that we run the date range for. So we're really looking at only worrying about our shelters and our street outreach programs, and for the most part of you, it's generally the shelters that you're looking at to set these dates. Are there questions, Meredith?
Yeah, Tiffany actually asked a very similar question to what you just answered. So Tiffany, if you still have questions, I think she answered it. Please raise your hand and we can talk through that. So there's a question here. Could the report start date be June 1st to get even closer to the first estimate of 1,644 people funded by ESG-CV?
Meredith is laughing because that's the question she told me you would ask first. You could, if it didn't go over, because it's going to exceed the 1,644. So you want to go closest without going over.
Someone asks, why wouldn't the report start date be February 1st for shelter B and C?
Because they're all in one bundle. So the initial report is going to carry everything in one bundle to do an unduplication as much as we possibly can. So remember, all the shelters are going to go in their own bundle, and they need to be started together. After the initial period, if you have shelters that started late or ended early, then the date ranges on those particular shelters will change and will show you different bundles. Again, SAGE does the calculation of bundles. You don't have to worry about what goes in what bundle. SAGE by the data you put into Sage. If you put the projects in correctly and put them in the correct project type, and if they started early or started later, ended early, and you put those dates in correctly, Sage will do all the math for you and put it all in the correct places. Meredith, I can't hear you.
Talking. Those were the only questions we had about the start date. So we can move on. Like I said, we did have a couple other questions, but I didn't know if you wanted to show something specific or talk about anything else specific first.
No, William is pointing you to some new ESG-CV resources that he wanted to point out.
Yeah, actually, it'd be nice to point at that the very top two. So number one, somebody already asked, do we have ESG-CV quarterly reporting guidance, a physical document? Unfortunately, not yet. The notice threw a couple of extra wrinkles that we have to adjust for, like some of the temporary emergency shelter piece. So we are adjusting for that. We will release something. My hope is it's next week. I can't 100% guarantee that that's when it's going to happen, but we know you guys need it. Reporting starts soon. The other one is ESG-CV quarterly reporting calendar. We released that today. This just gives you a sense of, for the players involved, kind of what we went over with roles earlier. When do you have to be engaging with reporting, right? So recipient, when do you need to first touch Sage? HMIS lead, when are you involved with aggregating and bundling? So it has a calendar that goes over those things. And so we strongly encourage you to do it. That's the type of thing where you kind of print it on the wall and you say, oh, crap, it's September. I know reporting's coming up. When do I need to do something? And it has it in calendar form, then you know when you need to do something. Yeah, we'll put those links in the chat.
And so we're open then for general questions. And remind you how to raise your hand if you want to talk to us directly.
So I'm going to just catch you up and read you a few of the questions then, Michelle and William. We are funding a provider specifically as a housing navigator to help clients who are getting RRH funds into housing as quickly as possible. They are not administering rental assistance. Should they still be set up and bundled as an RRH group?
So housing, go ahead, William.
So let's jump in on this one. I responded in the comments on this one. It actually isn't easy to answer this one out loud. There are levels of nuance that we actually have to understand to know more about that. For instance, what are the funding sources for the rapid rehousing projects involved? What are they providing? Are they providing housing, services, a mix, again, who's funding them? So that's the type of thing, unfortunately, I would say submit an AAQ, provide those kind of extra layers of detail because there's a few contingencies that may push this one way or the other.
So what I do want to throw in there, William, is that the only things that you can fund are things that are eligible under ESG-CV. And there's nothing called a housing navigator eligible under ESG-CV. So you've got to tell us where did you fund it in those line items? Was it an essential service under RRH? Is that part of the service part that you did? If it is, and it could be, then HUD would say, yes, it's RRH.
Thank you. There's a question here. It says the reporting period to run for Sage is June, July 1, but the HMIS start date should be the date the project began operating. Is that right?
The date that the start date that you're calculating back here, this like when did the program start? We're assuming that if you funded it for July 1st, you funded it to start on July 1st. It's not like you funded it to start on July 1st and they took 6 months to figure out when they were going to get it in gear and do something. This is a response to a crisis. So if you started them July 1st, they should have had people, give or take, right around July 1st. There shouldn't really be a difference of the HMIS start date and your, I think you're thinking of it as contract period.
Thanks. Can you switch over to Sage? There were a couple of questions about Sage. One being, is there a way to view the report before you fill it in? And then someone had a specific question about the financial information screens.
I can, I hope, I think.
Maybe while you're doing that, I can ask William this question. Can trailers be treated as temporary shelters, or can they be deemed permanent housing? Does the affixed requirement 9, as imposed with home, apply to trailers as permanent housing units?
I think the verdict is still out on the permanent housing. It depends on several variables. Temporary emergency shelter, that's very likely a possibility. Again, provide a few more details. I'd submit that to an AAQ, but we envision that trailers are likely going to be used. We've seen FEMA trailers already used in some jurisdictions, so trailers are something we would expect to see for temporary emergency shelter.
Okay.
So on the print, I'm not sure what she wants to print. If before you submit it to HUD, you want to print and see what came in or what you said, you can use this view print option here. If you want to actually look at a bundle that came in, oops, went to the wrong screen, sorry. If you want to look at an actual bundle that came in, you know the bundles that you sent from that screen. You know what kind of shelter it is. When you look at the review and sent bundles, you got the 31 bundles from that, and you can see the CSV that they submitted, the entire CSV, or you can see just questions 4 and 5, which shows you all of the individual shelters that, or individual projects, organizations and projects that were included in this upload. I'm not sure if that's what you're wanting to view and print, but if that's it, that's how you can do it. And then
and
the
other question was, yes, the financial form. And can you explain the rental housing?
Rental housing, go ahead, William.
That's just the normal eligible costs of this form. If you're familiar with normal kind of ESG reporting, this is a copy for the most part of what's reported in the CR75. So rental housing would be the same costs that you would charge as rental housing under normal ESG. That's generally the cost of rent itself. And so that's, but there's no unique things under ESG-CV for rental housing.
Thank you. I think that was all my Sage questions I saw come in, but there was another question about your example. And they're kind of confused about how the 1644 number was determined. So that average number of people. I want to flip back to that real fast.
Maybe. So the 1644 is so shelter A went from July 1st through the end of September. That's 3 months. So if you took the average served 250 a month, and they were in operation for the 3 months, that's 750, right? Versus shelter B and C that were actually operational for 9 months with ESG-CV money, and that's why on average we got those. So the average real number of the people, the estimated real number of the people you served is 1644.
I think this person went on to clarify what I'm referring to as the project start date in HMIS. Oh, shoot, I just moved. If we have funded, if the project began serving people in May, but the majority were not served until July, this impacts the reporting period for the CAPER, but should it also change the project start date in HMIS?
So ESG-CV reporting does not align with your CAPER like regular ESG reporting. William, is there a better way to say that?
Well, I think the short answer is no. Don't change the HMIS record for that. We know that there's some incongruence in the HMIS record for some of this. To ensure that we get to the closest or most accurate reflection of the number of people that you served, that's okay. And if there is a concern about documentation, this is just a reminder that the HMIS is not your system of record. You need to ensure you continue to have case files that show when a person was served. And so actually your HMIS start date should align with those records. Your bundles, we know, again, may be a little off per the calculation we shared here, and that's just to, again, try to get as accurate and least duplicated number as possible. So it's a great question because this is the area where we knew there would be confusion because it's asking for some incongruence in the dates, but that's where I want to be clear that on the monitoring / documentation / audit OIG piece, just remember you're carrying your own local client files that will that need to be reflecting the dates when people were actually served, and your HMIS record will most conform with that, right? When you started serving people under ESG-CV, we'll have a starting date that corroborates with that record. So hopefully that's helpful. Again, we know that's a confusing principle.
I think we have 2 more questions here. If we have funded an existing emergency shelter so that they could expand their hours, they secured other funding as well. They have not started drawing down their ESG-CV funding yet. They will not start billing until October. Should we include them in the bundle with the other ES who has started serving clients and drawing down funds?
No. If they don't start till October, they're going to be considered a late starter, and you'll show them with an October start date in the first real quarter that you report on.
Thank you. So this person has an agency operating homelessness prevention funded with regular ESG funds, but they also received ESG-CV funds. This person recommended they start a new HMIS project to track them separately.
That's
is
correct.
that the correct recommendation? Yes. Not only is it the recommendation, but that's what they should be doing. They should have a separate project set up for their ESG-CV funded prevention project. I think that is all. Oh, there's one, of course. We have 2 projects that will be funded by city ESG-CV, prevention and rapid rehousing. We know we need to set up 2 separate projects. Do we need to break the case management services out into another project for reporting services since these case management services are being provided as part of each project? Would we only report out on the RRH and prevention activities?
Yes,
so
you're going to want to
Go
sorry,
on,
I'll jump in. You want to make sure your services, especially your costs, are aligned with the grant they're being charged under and the appropriate component type. So this is exactly the type of thing when it comes to monitoring, you need to be able to show, and this is usually through staff prorating, right? X% of a person's time went to rapid rehousing versus homeless prevention. So yes, you're going to need to keep those services in the appropriate component buckets.
But to be clear, there's still just two projects set up in HMIS, right? There's a prevention project, there's a rapid rehousing project. There is not some other sort of case management services only project. There is a rapid rehousing and a prevention.
That's correct.
Right. Yeah, don't set up a separate project for that piece. That will actually cause more confusion. But yes, leave it in two HMIS projects in that case.
So that's all the questions we have, and we are at 4 o'clock at this point. I think that's when this call is slated to end. So I don't know if you have anything else you want to add.
No, I think just recognize, we know that this is just the tip of the iceberg. More questions will come. As you get into the system more, you'll have more questions. This is great. We love your questions. I'm sorry for the ones we can't answer, but please come to the next office hours with more questions, and we will do our best to answer what we can. So thank you again for participating today, and we look forward to seeing you again in the coming weeks.